All right, so I gathered my equipment, I washed my hands. I'm going to provide for privacy for my patient. Can you give me your name and your date of birth?
Kaylee Hall, March 2nd, 2005.
All right, Kaylee, my name is Jamie. I'm going to be your nurse today, taking care of you. We're going to go through and do an abdominal assessment and a neurological assessment. Is that okay with you?
Yes.
All right. So as we do this, we are going to try to keep you covered. I will have to expose your abdomen, just so you know, so we'll bring your shirt up to about here. You might have to lower your pants just a little bit so that I can hear in all of those quadrants. I will be comparing side to side, and then I'm only going to uncover one area at a time, just so that you know. So can you tell me where we are today?
We're at Northern Michigan,
Okay, and can you tell me the date today?
October 22nd.
All right, perfect. So my patient was able to tell me where she was, who she was, and where or what the time is. So she is oriented ×3. Can you tell me what class you just came from?
Holistic Health.
Holistic Health. All right, fantastic. And then can you tell me what year you started college?
2023.
Okay, fantastic. So you were able to verify that your recent memory and your remote memory are intact. So then we're looking at your judgment. So in the event that you lost your job, what would you do?
Find a new job.
Find a new job. All right. Okay. And then as I've been questioning you these things, I noticed that your thought process is logical, relevant, organized, and coherent. So one of the things that I have to do is called a pronator drift. And so what I'm going to do is I'm going to have you put your hands up facing the ceiling, kind of like you're holding bowls of soup. And then you're going to close your eyes and just keep your arms up in the air for me, okay? All right. Okay, you can go ahead and let that down. And I see a negative pronator drift. So the next thing I'm going to do is I'm going to have you grip my hands. So if you will, just give my hands a really good squeeze. Good. All right, fantastic. And so our hand grip is 5 out of 5 bilaterally. And now we're going to do elbow flexion and extension. So as you're moving your elbows towards you, you're going to go like this and then bring it towards you, okay? And I'm going to have you move it just like that. Then I'm going to put my hands here and you're going to move them over resistance towards you. Yep, go ahead and pull them towards you. Fantastic, okay? So then on the other side, we're going to have you extend your hands, okay? So I'm going to put my hands out. Not exactly the best body mechanics, just FYI, but all right, so you were able to do elbow flexion and extension. You were 5 out of 5 bilaterally and able to overcome resistance. So this next one is called a hip flexion, and I'm going to have you sit on the end of the bed for me to do that, if you will. And camera, will you come on over here? All right, so as we do this one, you'll feel my hand on your hip, and I'm just going to have you lift up your knee. All right, and then I'm going to flip sides. Don't follow camera, please. All right, and same thing. Okay, and now while I'm here, your hip flexion is 5 out of 5 bilaterally, but I'm going to do your knees next. And so what you're going to do is you're going to pull your knees towards you, and that is going to be your flexion. So go ahead and pull towards you. All right, and then on this side, you're going to push away. Push away. Good, fantastic. So her knee flexion and extension is 5 out of 5 bilaterally, and you're able to overcome resistance. So the next one that we're going to do is actually take a look at your feet, and it might be easiest if you actually lay down for this one. I think you'll appreciate that.
Like what?
You can keep your socks on, no problem there. All right, so go ahead and lay down. And what I'm going to have you do is I'm just going to have you, body mechanics, I would move the bed up. FYI. I'm going to have you push on my hands like you're pushing on the gas pedal. Push, 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 push. Good. All right, so then you're going to pull your toes towards your nose and you'll feel me put some pressure on your, there you go. Good. So my foot plantar flexion and dorsiflexion is 5 out of 5 bilaterally. All right, so then we go to our cranial nerve 7. If you, actually, you might as well just stay like that because we're going to do your abdomen assessment. So what I would like you to do is, can you raise your eyebrows for me?
I think so.
Okay, all right. Can you frown for me? Can you smile for me? and show me your teeth. All right. So by doing those 4 movements, you told me that cranial nerve 7, your facial nerve, is intact. So the next one that we're going to look at is cranial nerve 12, which is the hypoglossal. What I'd like you to do, if you will, is stick your tongue straight out at me, and then I'm just going to have you move it side to side. There you go. Thank you. So as you did that, cranial nerve 12, the hypoglossal nerve, is intact. So now we come to the part where we do the abdominal assessment. So when I do this, I'm going to have your hands at your side, and I'm going to have you actually bend your knees, if you will. There you go. Perfect. Are you ticklish at all?
Mildly.
Mildly. Okay, so one thing that you can do if you are ticklish is you may want to hold your hands like this, and that will help you from moving around, okay? As I do this again, I will not be exposing genitals at all, but I will ask if you will move your shirt up for me. Perfect. And your pants should be all right. Okay, so then I'm of course going to warm my hands, make sure that I have short fingernails, make sure that I have a clean stethoscope prior to coming in to see you. I'm going to ask you if you have any pain today.
0 pain.
0 pain, all right. If you did have pain, I would assess that area last. And I'm on your right side so that I start on your right lower quadrant and it follows the track that the bowels go through, okay? So first and foremost, I'm looking at your skin, which is congruent with the rest of the body. And again, I can warm and dry. Her symmetry, her abdomen is symmetrical, her umbilicus is midline, and then one of the things that I'm going to have you do is just kind of lift your head in kind of like a half crunch. As you do that, that would let me see if there's a hernia there. You don't even have to move your arms when you do that, just moving your head up will increase that abdominal pressure, and if you had a hernia, it would pop out for me, and you have no hernia present, so thank you for doing that. So the next thing that I need to do is I need to take a listen to your bowel sounds. So you're gonna feel me put my stethoscope on. I tried to warm it up a little bit. It'll still be cold. I'm sorry. So put it in. I'm gonna tap my diaphragm just to make sure that I'm on the right side. Okay. So start in my right lower quadrant. And if I hear bowel sounds, then I can go ahead and move to the next area. If I don't hear bowel sounds, I'm going to listen for at least a minute and about 20 seconds or so before I would move to the next area. And your belly is moving. I would say that your bowel sounds are actually hypoactive. They're not moving a ton, but that's okay. Actually, I got to have you keep that up for just a minute. So after that, then I need to assess for abdominal bruits. So when I do that, there will be a couple places that I'm going to go to. So I'm going to go right where your descending aorta is, okay? And so you'll feel me here, and then just a little ways down from that, I'm going to do your renal arteries on the left side and the right side and compare, and then I'm going to go for your iliac, which are also going to be on the right and left side, okay? So when I do that, I have to listen with the bell, or I'm sorry, with the bell. I hear your belly. And ideally, I would go on skin so that I'm not doing it, but I'm not flashing it to the whole class. Okay, so I had no abdominal bruits heard, and the majority of the time when we listen here, we may not hear anything at all, okay, because it's a little bit further away from the heart, but if we have a patient who has an aneurysm, it is very possible that we may hear something there, and it might be our first sign that there's something going on with our patient. So then the next thing that I'm going to do is I'm going to do some light palpation. So that means I need to put my hands on you, okay? We're going to go from the right lower quadrant to the right upper quadrant, then over to the left upper quadrant to the left lower. So we have our right lower quadrant, which is where our appendix is. We have our right upper quadrant where we have our liver, spleen, and part of our pancreas. We have our left upper, which is our gallbladder and our pancreas, and that right lower quadrant, there's nothing there. other than bowel. So I did not feel any masses, tenderness, or rigidity when I did that, and I did verify with you that you didn't have any pain before we started the assessment. Otherwise, I would have done that last. The last thing I have to do is tell you thank you so much for being my patient, and we'll get the provider in to see you.
Perfect.
May I help you up?